And we are live. Thank you, everyone. Would like to welcome everyone to today's Tiger webinar featuring the topic Social Vulnerabilities in COVID-19. I'm John Rodabaugh, Executive Director of Alumni Relations, and I will be serving as your moderator today. We are happy to have you join us and hope that you and our entire Tiger family are well and continue to weather this new environment during the pandemic. We want you to know that the Office of Alumni Relations is available to help all alumni with a variety of needs, including new virtual content, learning opportunities, and networking and career assistance. We especially encourage everyone to connect to the RIT Alumni Association's social media channels, including Facebook, LinkedIn, and Twitter, where you will find up-to-date communications and opportunities to connect with the university and to other alumni in the region and your industry. Those links can be found in the chat box. The chat box can be opened by clicking on the chat tab at the right of your webinar window. Many in our RIT family have asked how they can help our students and the university as we respond to the pandemic, and we are very grateful for those offers. There are two ways that you can help. First, our new graduates and current students are seeking positions for full-time careers and co-ops. Many of these positions have been delayed or canceled entirely. If your company is hiring or would consider adding a co-op post, please contact our Career Services Office and allow our Career Services Office to post that position in our systems. You can see some information on that in the chat. In addition, there is now an unprecedented need for financial aid and scholarships for current and incoming students. And if you are willing and able, please consider making a gift at the link in the chat box. Thank you. We want to ensure that everyone is ready and familiar with the presentation tools. If you are joining from a remote location and are currently signed into your company's VPN, we encourage you to close that channel during the webinar to increase the quality of your transmission. The webinar platform is secure without VPN. All attendees have joined in mute mode. However, your questions can be entered in the chat box at any time throughout the discussion. We will make every effort to address all of your comments and questions throughout the webinar. You are joining this event using broadcast audio. If you wish to dial in by phone, dial-in information is provided in the chat box. Live captioning is also provided, and you can find the link to access that in the chat box as well. This webinar will be recorded and made available, complete with captions, in approximately 1 week following today's event. All participants will receive an email with the link to the recording. If you have any technical questions, please feel free to type those into the chat box as well, and we will do our best to get you the appropriate answers. Now onto our webinar, Social Vulnerabilities in COVID-19. Part 2 of our critical thinking series on living and leading through the pandemic. We are so pleased to welcome RIT alumna Suzanne Frew MFA 86, who leads the Frew Group, a women-owned small business based in the San Francisco Bay Area. Suzanne supports public and private sector clients in creating culturally competent policies, programs, exercise and training, and communication strategies in disaster resilience, response, and recovery. Joining Suzanne is Dr. Jessica Pardee, Associate Professor in the Science, Technology, and Society Department at RIT. Dr. Pardee earned her degree in 2009 from Tulane in New Orleans, where she was enrolled at the time of Hurricane Katrina. In 2014, she published the book Surviving Katrina, a study in the survival strategies of low-income African-American women during and following the hurricane. I'd also like to welcome longtime RIT professor and current Director of Diversity Theater at RIT, Tina Chapman DaCosta, on the webinar, who will be available also to chime in on the chat and share her viewpoints and talk a little bit about what we're doing at RIT from the Division of Diversity and Inclusion. I can't think of a more timely and critical discussion topic than what we'll talk about today, especially in light of what our communities have been through in the past week with both the pandemic and protests. So at this point, I'd like to give the floor to Jessica Pardee to tell us a little bit about her background. So Jessica, take it away.
Okay, so I was originally not a disaster researcher. I was interested in public housing redevelopment and the impacts on families living in public housing in New Orleans, which was almost absolutely segregated. At that time, there were just 19 families who were white in the entire system of over 33,000 families. So you were looking at a situation that was very much on a African-American white dynamic back and forth, and incredibly segregated. And so my original work was looking at the impacts of public housing reform and how that affected the abilities of families to build social wealth and capital and improve their experiences. And then Katrina came through, and just as the new public housing was reopening and families were moving back in and intended to have new quality housing that should have helped to offer a pathway to wealth generation and a better life, at least that's how the programming was framed. Katrina came through and flooded one of the two communities. So I changed my research area from being an urban sociologist to a disaster sociologist, but continued to study the women and their families who were living in those communities to understand how they survived disaster. One of the things as sociology of disaster, we know a lot about how big communities recover. We know a lot about how middle-class people recover, but we have very limited research about how communities of color respond, how they recover from disasters, and even less about how someone living in poverty is able to come back, in part because our definition in sociology of disaster recovery is to return to normal, but the characteristics of disaster and failed recovery are the same characteristics of living in poverty every single day in the United States, and that has not changed in the time since Hurricane Katrina in 2005. And so what you have then is a question that says, how do you recover from a disaster if your life has the same characteristics as what scholars call failed disaster recovery? So that was how I became a disaster sociologist, and I have had sort of a long-term kind of commitment and interest in thinking about these issues, even now that I'm in the Science Technology Society department, right, looking at the ways how we build housing has been a system of how we build housing has been racialized from the start, and teaching students about that experience and understanding how we get to the social inequalities that we see today and why they've been maintained over time, despite legislative changes and 52 years to fix the problems. So I think a lot of that is deeply connected to what we're seeing today in terms of social protests, but also understanding the differential impacts of the pandemic going in. So one thing that disasters do is they rapidly highlight the inequalities in society, and then they exacerbate them and make them much worse.
Thanks, Jessica. And now Suzanne, proud alumna from RIT. Why don't you tell us a little bit about your background?
Thanks, John. It's great being here on the webinar today. So really appreciate the invitation. So my background was actually, I came out of RIT focusing on, and Jessica and I discovered this as we were prepping for this, I was looking at the issues of housing and mental health and homelessness in Rochester years ago. And I had come out of social justice background in my undergraduate work in the Deep South, and then ended up at RIT as a visual, my real big focus was visual documentary. And so I was a photographer and a videographer producing a lot of materials, and eventually got picked up by FEMA, the Federal Emergency Management Agency, many years ago, when they discovered sort of what my background was in looking at issues of these diverse populations and how do we really support them and engage with them and document them in a way that people can better understand what they're going through. So I spent 10 years working for FEMA, and my first disaster was out in Micronesia, learning how to interpret cultural differences in a traditional government response and recovery operation. And since that time, I've stayed with it over the decades, and I have been working in the East Coast, out in Asia, spent a lot of time working in Asia with different governments out there. And then I'm currently in the San Francisco Bay Area. And my real, my specialty is really looking at how do we build cultural competency. And a lot of people don't really know how to do that. They don't know how to operationalize that when you're really looking at policy in the field. A lot of times when we talk about it in communication, people say, oh, change it to Spanish. Well, that doesn't always work. There's a lot of culture that goes into the formation of words and the way we do messaging. And when you've got a really fast moving event, which we've had a lot of here, for example, in the last couple of years, we've had a lot of wildfires and we've had a lot of deaths associated with those wildfires. And having messaging that goes out that people understand, if they are coming from another country or if they're undocumented, If they are living in a community where they depend on their child as an interpreter, that is a huge piece of information that a lot of practitioners are trying to figure out how to build that into their programs. And so I run the Frew Group. It's a small consulting firm, and work with different organizations on how to really help them be culturally competent, how to really figure out how to identify who's in their community and how do you reach them, who's your trusted champion. And so that's what I've been doing for a number of years. And really thrilled to be back with RIT. And we were supposed to be out there last couple months ago. And of course, we're all in the COVID environment. So it's great to be here.
Thanks, Suzanne. I'd also like to welcome Tina to the conversation, who I want to give you a special shout out because you did this on short notice. We asked you to join the conversation, I think, yesterday, and we're really excited to have you with us as well. And so Tina Chapman DaCosta, also, I believe, an alum. I have to say that because I'm in the alumni office. So we're very happy to have you. So Tina, can you just tell us a little bit about yourself and some of the work you do here at RIT?
Oh, thank you, John. And thank you for the opportunity to join this conversation. I am a proud alum of RIT. I have 2 masters from RIT, and I expand my left and right side of my brain for the work that I do. I started off as an engineer with IBM when I first finished my undergraduate degrees in computer science and mathematics. And I worked mainly within the Rochester community with different organizations here, Fortune 500 companies and educational institutions, helping them to install Unix-based systems so that they can advance their platforms and be able to provide data processing needs. In that time period, I also started teaching as an adjunct professor in the evening, and I really enjoyed just being in front of students and working with them. First working at MCC with the adjunct teaching there, and then later was recruited to come to RIT to help start the information technology department, which was in the Golisano College of Computing. So my first introduction to RIT, was coming in through the computing side of things, and helped to develop our network security and system administration department. And later that's become computer security forensics, and still part of the information technology degree program in terms of how things sort of got split up. But in that time period, I really enjoyed not just working with individuals from an educational standpoint, but also from organizational development. And I also had an opportunity to start working as a diversity consultant, sort of in between IBM and RIT. I worked with an organization called the Winters Group in the 90s and in the early 2000s, and worked predominantly with Eastman Kodak Company when they were going through their transformation. Their imagine the possibilities of being able to redesign and reorganize, the organizational structure and give people an opportunity to transform into other lines of work due to some of the economic changes that were going on. But along that journey, I found a love of working in diversity and inclusion and equity work. And after I sort of as we say, gave my contributions to the Golisano College, I then set my sights on doing more work in organizational development. I have my master's in engineering, and I got another master's in filmmaking, both from RIT. So I loved hearing Suzanne talk about, your visual documentary work and so forth. And I also got interested in playback theater. So a lot of the work that I started positioning myself to do in the realm of organizational development or diversity, equity, inclusion work was in the line of filmmaking and also in live theater. So I had an opportunity to start a program at RIT called Diversity Theater. And I also transitioned from the Golisano College into the Division for Diversity and Inclusion as the Director of Diversity Theater in terms of developing that program, and also as a senior lecturer in COLA. So I also teach the courses in the performing arts and visual culture area. And now, we'll see how our new developments are going, with our performing arts degree programs. So I'm very, very excited about that. But the mentioning of the film and the live theater aspect has become really the hallmarks of what I do for diversity theater. And I'll explain it just briefly this way. So one is on the filmmaking side. Diversity Theater produced its first film called Brick by Brick that was written and directed by myself. And it's a narrative, but it's about my father's life story and his accomplishments as the first African-American licensed and bonded contractor in Cleveland in the 1950s. But we use that film as a way to engage the audience into dialogue, to not just experience a day in a life of the protagonist, but also what does that mean for us? And I give people an opportunity to reflect upon their own journeys and their own cultural identities, and trying to develop cultural competencies, within the small groups that they work within as they are experiencing the film. And we'll continue to roll that out, on campus. The other aspect of the live theater, after actually trying a couple different focuses like traditional theater and vignettes and so forth, I've really sort of honed in on playback theater. And I mention that because Jessica's work in Katrina is most interesting because playback theater is a form of improvisational theater in the 70s, but much more prominent outside of the US. It's in over 60 countries with over 700 troops. But one of the ways it had been used is after 2005 and the disaster in Louisiana, you had playback theater company that came in to work with survivors, of Katrina, so that they can share their stories. And you find that it's just very, very powerful in terms of people being able to not only share their stories, but to see them enacted on the spot by playback theater actors and musicians, and the rest of the audience be able to vicariously, experience those moments, but getting to know each other better. And so I bring those two types of approaches into the diversity theater program at RIT. And I can talk later, about some of our workshops and things that we're doing for RIT faculty, staff, and students, and community members, and how I enlist the help and aid of other alum, for the work that we do, from either developing the film or developing and presenting some of the playback theater workshops that we do. So I'm very honored to be a part of this discussion and to share some of the things that we are doing currently within the Division of Diversity and Inclusion to help us maintain our community even through this time of physical distancing and other national and local events occurring.
Thanks, Tina. So I think all of you have mentioned, the work that you've done and certainly the way that it's impacting our communities. But we'll start with Jessica. How has the pandemic changed your thinking?
I think in many ways, and Suzanne and I have talked about this, but I don't know that it has. I think that it's brought to light a lot of the issues that we already had going on. I think seeing some of the disparities in terms of who is impacted. I think a lot of those things, as a trained sociologist, I've been doing this for a while. So what it's doing is about the same thing that Katrina did, which is all of a sudden people are aware of problems that have existed for decades and decades and decades and decades. And people get upset about homelessness in the 80s, and then we do a bunch of research about homelessness in the 80s, and we pass the McKinney Act, and then we forget and move on, right? And I think that with Katrina, we look at it and we're like, why are we seeing such disparities? And who's up on roofs waving flags saying help? Why is it all people of color, African Americans, Black New Orleanians? Why is that? And then people are upset for a while, and then it just stops. And so in many ways, I feel that the pandemic has just been a poignant reminder of the work we've failed to do as a society to address our social vulnerabilities. In many ways, I think that we're seeing people being very upset about not being able to walk outside without a mask. And that's really a problem of true privilege. When I think back to Katrina, right, and this was a very large regional, it impacted 90,000 square miles of area in the Gulf Coast. Right, you had people without homes, not just without food a little bit, like long-term without homes or foods or job. And in many ways, most Americans have had a fairly privileged experience in that the roof is over their head, the electricity is still on, the water is still on, and they have to work to get unemployment by calling a lot, or they have to go get food. And these things are legitimate, serious issues. But the scale is very different when we compare it to other types of disasters. And so I think the pandemic, if anything, it's made me aware of how fragile even middle-class families are in terms of being able to be prepared for a job shortage, because in many cases that's what the pandemic, it wasn't the COVID itself so much as not being able to go to work and bring home a paycheck, that fragility. So in the best economy we've had in a very long time, we're being told at the same time, right, look at how quickly people's capacity to pay for their food has collapsed. And I think that if anything, it's reminded me and re-encouraged me that we need to be having public conversations about how to create sort of sustainability for all households in the US, so that people aren't living paycheck to paycheck. And so that when something like this happens, people can recover, that it doesn't set them back, you know, to a place where they can never really recover. So, and again, keeping in mind that we are in an ongoing pandemic. The disaster is not over. We are not done. We are kind of just getting started for wave 2. And so I think that's something that we need to keep in mind, that perhaps the thing that has changed is I think the need for long range thinking is more necessary than ever in the United States, kind of as a community conversation. How do we keep families and households sustainable in the long range, right? And what kind of social practices, policies, laws, living wage things might we need to be able to do that? So I don't know that it's changed it much, but I think it's helped other members of our society see the need in ways that perhaps they hadn't.
And Suzanne, from the consultant kind of viewpoint, you know, how's the pandemic changed your thinking, or maybe even your business?
Well, I don't think it's changed, like Jess was saying, it's changed anything per se, but it has really, really driven home the issues of the social inequity. And I think we're seeing it very, very clear in life and death. And I think right now we're seeing it across the country in a lot of ways that is now really starting to be very clearly documented. And I think that's part of the piece of the conversation as emergency managers and as people who are public health specialists and as people who are working in the community. There's systemic racism, and there's risk factors, and there's the issue between COVID disease and death, and it's really clear and it's being documented. And I think what we're trying to do is we're trying to now look and to see how to address this. We know that there's issues regarding low-income workers who just they can't work remotely. It might be a privilege to work remotely, but a lot of people cannot work remotely. And there's those types of issues of who's actually getting to stay at home, who's having to go to work, who's going to be on the public buses. There's issues of the low-income service workers who are supporting all aspects of our different communities across the country. Then there's the issue of how we're looking at the issues of even social distancing, and we're looking at the issues of who's getting ticketed. And there were some statistics that came out of New York City that the arrests for social distancing, when they actually went in and they did an analysis of who was getting arrested, and it's like 68% of those who were detained were Black and 24 were Hispanic. I mean, the statistics are really getting documented right now in a very stark way. And the issue here is that a lot of people don't have access to good personal protective equipment. And so we're seeing the schism that's even becoming more entrenched. And the CDC is beginning to document it on their website. They're beginning to look at where the deaths are in New York City. Jess and I talked about, New Orleans. I live right here in the San Francisco Bay Area. I'm right by Oakland. I mean, we've got some really big issues regarding social vulnerability here. And now we've got the protests. And so, when you have the protests going on, we've got issues. We're once again putting people at risk. We're putting them together in a way that places them even more at risk. And the fear now is looking at everybody who is out there, really making a statement about their dignity and making a statement about what is right and what's justifiable. Suddenly they're once again put into a situation where they're even more at risk, and there could be even more deaths. So I think that the way it is, where it's showing up is we're seeing clearly documented issues now that is showing up in truly life and death, and it's crossing all kinds of geographical lines. And then you have to look at the rural population. So we've got the issues with the rural population where there is very little resources, and now it's starting to move out into the rural communities. I mean, we already know the detention centers and the prisons, and those particular environments. There was like almost 30,000 inmates that tested positive. I mean, these are really big statistics, and these are things that we're going to have to grapple with. And as Jess said, we're not done. We're in the middle of this, and we don't know what the next wave is going to be. So as emergency managers, people are trying to plan out for some things, and we can talk about that in a few minutes, but what lies ahead. So that's what I'm seeing,
Thanks, Suzanne. And Tina, I want to get your take too, especially here on campus in the Rochester area. What are you seeing in some of the work you're doing, and has this pandemic changed your thinking at all, and how your approach to your job has been?
Obviously, there's a lot to be said in that question in terms of an answer. Let me start with in terms of what I have seen as changes and the impact for my work in particular. So as I mentioned earlier, diversity theater engages audiences using theater-based methods. So we typically have facilitators, performers, and you have an audience. So with the shelter in place and, the campus physically, not allowing students on campus and things like that, the work I do and the channels that I use definitely had to change. So for example, we have ported our playback theater workshops onto a Zoom platform in which we are able to have my actors and facilitators who are in their shelter in place in their homes come together on a virtual space and be able to actually embody the type of work that we were doing in a physical space. For example, we did a workshop for the College of Science a few weeks ago, and it was entitled Social Distance, Community Building During Social Distancing.
Cool.
We had about 27 people or so in total on that. And my team was about 4 or 5 people who were in different locations. And we used the Zoom platform for them to be able to use music and acting in a way to honor the stories that people were sharing as these tellers. So we were able to practice, with the Zoom platform, for example, of how do you make it look, like a stage setup? How do you make it all go dark so we don't see anyone's video and hiding non-video participants, and then being able to do that. But the biggest challenge was, how are you still impactful with it? The first time we were practicing, I didn't feel very good about it because I'm used to that immediate connection that you're having with people being in the same room, in the same space, and you can kind of sense and feel, their emotional connection or disconnection with what you're doing. And we didn't really have that. So we had to kind of augment this form in a way in which we could use it better in this space. So some of the things that we have done is really showcase more of having small monologues of someone being able to then embody a person's story, through that short monologue, and then build that into a series of monologues so that you can get the full experience of what we were trying to capture in terms of the essence of what the person was saying. And I'm just so pleased that the feedback we then received from the participants was that I felt connected, because that was the objective. To reach out to people to let them know that we are still with you and we haven't forgotten you and you're connected. So it was nice to see that we were able to still hold that element of truth for people engaging in that way. The other thing too was the benefit was now we could include people who were all over the United States or even outside of the United States, of having them log in, via Zoom, Blue Jeans, or Livestorm, for example, of those particular types of platforms. So on the other hand, we've been able to expand the reach that we were limited to before in terms of people being physically there. We are still experimenting and practicing with different ways in which we can do these types of offerings. But that's one of the, sort of changes for certain in terms of the shelter in place and with the pandemic going on, in terms of how we go about delivering and connecting. The other things that were different for me, and again, we're talking about the pandemic, not so much right now, I guess, about the items that are going on presently, locally and nationally regarding the inequalities that are occurring, especially out on the streets with policing and things like that. But just being sequestered, for this length of time has caused me to really rethink how I spend my time. My husband and I were talking to each other, and we were saying, well, what are the first thing you would do, once things are lifted or the economy comes back? And honestly, there really wasn't a whole lot. There wasn't like I felt like I had to run out and do a lot of those busy things I was doing before. I mean, yes, I miss seeing, friends and family, and we've developed new ways to stay in touch and taking advantage of some of these technologies that have been here for a while, but we just weren't always doing FaceTime and things like that. But many of the people that I've talked to and those who are involved in the work that I do start to talk more about not just valuing their time, but valuing the downtime and valuing the solitude and being able to reflect, which is something that I've always encouraged people to do, especially in the work that we do. And I'm sure Jessica and Suzanne can attest to this. You need people to reflect, upon their own experiences and be able to engage in learning more about the experiences of others, because sometimes that's where we have to start with in terms of that empathy, so that we can now find our shared values. We may have different approaches and different ideas of how to go about doing things, but if we can identify the shared values that we have, the core values, then we have a foundation to stand on in which to work from. And I think some of the changes that have occurred due to this pandemic has given people an opportunity to make those types of connections and awareness. And now we come together in a new way in order to do the work that we know is important and still is unfinished. So in terms of further division on campus, we have worked very hard to try to reach out to students and let them know that we are still there with them. Obviously, from making sure they've got laptops and other technical means so that they can still do their classes and connect. But we're also there to try to support the faculty and the staff who were under tremendous pressure to convert everything to online platforms, in a matter of a week or two. And if you have never done an online class before, or have so much material that it didn't really, look like that was going to fit in that type of platform, right, that was a huge task. So we've been trying to also be there for faculty and staff, giving them a voice and giving them an opportunity to connect with one another while we are all transitioning and going through this. And at the same time, connecting with our students so they know that we are still there for them. From what we've done for graduation, for what we're doing for the summer programs, or the ones that have an online presence that are still taking place. And then also today with the joint communications that went out yesterday, I guess, from President Munson and Dr. Keith Jenkins, our VP of Diversity and Inclusion, even the Division for Diversity and Inclusion, to say that we are still here and we are working very hard to make sure that the importance of the work that we're doing still is felt and impacted in the ways in which we know can make a difference. But we don't have all the answers either. And we need people like the ones on this call right now and those who are listening to be a part of that and to be active, because we are all in this together, as we've heard the term, but it is the truth of that. And one thing with the pandemic, even though it has an inequitable impact, but it also has no discrimination in terms of who is impacted by this pandemic and by COVID-19. So we are all in this together.
It's a great point, Tina. And I think all of you mentioned a little bit about some of the longer term implications of what we're seeing with this pandemic. So Jessica, I want to ask you, as we chart our course through this, any other thoughts on these long-term implications, and where do we end up 2-3 months from now?
I think one we should consider is, on the one hand, we want to stay safe during the pandemic, but we also have to think about some of these issues, and this kind of bleeds a little bit into the the third question I know you're going to ask me about critical thoughts. But, you know, when we think about legacies of things like employment discrimination for all people impacted in this pandemic, we might start to question about, or at least think through, is it reasonable to give employers the power to test employees so that they could potentially use it to justify not hiring someone back? No one's really talked about that. We've plowed forward saying we have to keep everyone safe, we have to keep everyone safe. And I certainly agree with that. I do think that we should kind of maybe think about what that means, though. We don't allow employers to test us for the flu. We don't allow employers to have access to our health records. This is like one of the few areas of privacy as a US citizen you have left, essentially. And, you know, when we kind of say, well, everybody's got to be tested before we go back, I think we maybe want to think about, is that universal policy that makes sense, or should that be only for employees who are site-based? So if you can do your work from home, should your employer have to force you into being tested if you're not in contact? You know, because there is also the opportunity then in that translating into either intentional or de facto discrimination, right? So if we have a disproportionate impact in communities of color and low-income communities, so the rate of COVID is higher in those communities, and then we require testing for everyone before they can go back to work, but that community has a higher rate of transmission, then what we're going to do is we're going to create a de facto situation that blocks individuals who are in vulnerable communities from being able to recover and to come back into the workforce to get wages that they need in order to recover. So the question becomes, are there other ways that we could do it? Can we create a face mask? I've got students who are, you know, we're creating face masks with the smile block for our deaf, hard of hearing students and population here in Rochester, right? Can we create a face mask that doesn't let COVID out so you could work if you were infected but asymptomatic, right? Can we use our technologies and our skills and our creativity to find a different way that doesn't, say, penalize people who are already being impacted differentially because they don't have the same access to healthcare, they don't have the same access to treatment for diabetes or heart disease or other factors that are known, and then they get struck out of the workplace because of sort of the mandate that the testing route is the only path we've discussed. And so can we find other workarounds, creative, sort of that hacker mentality, right? That is quintessential RIT. Can we find a hack that can have someone who is healthy with COVID but still able to work but not transmit? So can we come up with that mask or some way that can prevent something that we want, right? We don't want to transmit the disease, but is testing and forcing people to stay home the only path to get there, or can we find another way? So I think that's something that, you know, in terms of the long-term pandemic, we have to be mindful that, you know, this idea of universal testing might not be yes on the testing, but are there other ways, right, that we can do it so it doesn't maintain and recreate and extend the inequalities or the impacts within communities further down the line. Also, in terms of the issue of retransmission, so, right, there's unknown and moving fluid evidence about whether you can get COVID-19 more than once, right? Or the idea of multiple strains. So you may have immunity, but you might not have immunity to all strains. There's lots of unknowns still that's evolving knowledge, right? So I think that we have to think about, you know, how, if you're in a community just with a high rate, if you're in a community with a lot of doctors. So I live in the neighborhood with the hospitals. I think some days when the wind blows really hard, is that going to just push things through my yard? Right? Like good hard wind, I'm not very far from one of our major hospitals. So I know my neighborhood has different impacts because we have a lot of healthcare workers in my neighborhood. And so could that mean if you can retransmit that you're now knocked out of the workforce potentially for a longer time because of where you live? So I think we might want to look to say, are there creative ways that we can, you know, find a techno fix, really? I mean, techno fixes generally, STS people are like, we have to be wary of techno fixes, but if we could find one that allows people to continue to participate, even if they're sick, right? Can we find a way to work that out where, you know, a transmissionless mask, I guess. Somebody in this audience hopefully is smart enough, they're like thinking already, and I'm hoping because they can make lots of money on that too, and then you can donate it back to RIT and support our programs, right? But I think we need to think about those impacts in terms of how we create reopening policy and workplace level reopening policy. for who can come back or under what circumstances, or can we find ways where, if we can make a job online while someone is impacted, they can continue to work? Because I don't think my experience as a professor who can teach my class online, should be something that we can't find a way so that everyone can get back to something starting to resemble normal and self-sufficiency and being able to take care of yourself. Because in my prior Katrina work, over time, families couldn't take care of themselves because they were already all financially strained. So you can only call on your family like in the short term. Ultimately, it falls down to sort of government and societal institutions to be the mainstay of recovery. And at least in the Katrina population, the women of color that I worked with. So I think that is something we need to keep in mind as we think about, that longer impact of the pandemic. How do we roll back and start moving into the reopening, but in ways that don't use the virus to recreate or further entrench the inequalities we had going into it.
And Suzanne, are you hearing some of those same concerns from your clients or in some of the work that you're doing?
Yes, I do. I'd like to bring up 4 other points, touch on 4 points that I think could add to that. I think one is of a key concern right now, long-term implication, is compounded risk due to concurrent incidences that we know are going to take place. We know it's going to be an extremely active hurricane season. That's pretty much given. And the issues about how we handle that at the local level is very unknown right now. And so the issues about how do we shelter, how do we feed people, how do we transport people, how do we reintroduce them back into the community is something that everyone is grappling with right now because we've never faced this before. So that extreme concern about compounded risk due to multiple incidents, that's going to be coming ahead. We're in Northern California. We're looking at wildfires. We know what's happening. We're entering a big drought right now. This is a huge concern. So we've got those issues across the country with different types of natural hazards. We're not even going to think that there's going to be an earthquake, okay? We don't even want to go there. I'm sitting right off of an earthquake fault. We've already had one in Salt Lake during this period. Those are issues. The second thing I want to bring up is this is really going to require a focus on long-term policy development. And I know in the emergency management community, in the communities where our job is to keep communities resilient, to keep them safe, and to be able to bring them back, how this is going to play into this in a pandemic environment is really, really critical. I've worked on public health issues before. I've worked with state health departments on Ebola planning and on working with the hospitals and the blood banks. And there's really big issues in this. And those long-term policy development on how do we have protection policies? And again, keeping an eye on the most vulnerable populations. And those are the diverse populations. This could also be our LGBTQ community. This could be the women. This can be communities of color. This can be on those with access and functional needs issues. These are very big. Being able to breathe on a respirator. If you are COVID positive and you are in the middle of a wildfire, these are really serious long-term implications that can have a very big impact on our community. The other piece is kind of in that context is that looking at the cultural aspects of our community populations. In working on Ebola here in the United States, in New Mexico, one of the things that we looked at is, we were looking at Ebola in Africa, we were looking at it in Southeast Asia on other environments, but how do we mark and celebrate death? And how do we do it in a context where we can have a funeral, where we can support our communities? These are issues that we're going to need to grapple with as we're addressing, as we move forward. And Tina, the things that you were talking about is just so beautiful. I've done a lot of work with Nepal and some of these other areas in street theater has been a godsend in a lot of these areas in risk communications. And I think what you're offering, I think, bringing that out nationally and internationally is really a really good piece. And the last point I'd like to make is that I also want to bring up that Daniel Aldrich, who's a professor of political science and public policy and very well known in social capital environments, he's brought in the fact that we have built a sense of cohesion in this pandemic that we haven't seen quite before, or perhaps that we're building on now in many ways for the first time. And I think building on some of those positive things, people are willing to put on a mask for the most part. People are willing to stay socially distanced. Those kinds of pieces are really interested in how we can move forward and how we can impact the way we actually serve the people in the community. So those are some of the longer term implications that I wanted to bring up. Some good, some not so good, some of deep concern, some with real positive potential.
Yeah, that's great, Suzanne. And Tina, I think from our standpoint, and for the three of us here that do work on campus, I think there's probably some concerns, even in long-term implications, even with our student population. Are you anticipating that as we roll into a potentially fall semester where we have students coming back to campus?
Oh, absolutely. I mean, those are the questions that keep us up at night, especially, the president's leadership team, in terms of if we are able to have an environment that's going to reduce the risk, right, of the virus spreading, what does that look like? How do we take advantage or make more efficient the use of our current space? For example, if you need so many square feet per student, obviously that's going to be different than the amount of square feet that we have today. So how many students can you have in a classroom? And therefore, how many additional sections do you need to offer, of that particular course? Because now you can't put 32 students in there. Maybe you only have 10 or 12 students in there. So those are very real questions that everyone is still looking at, and rightly so. And then moving forward, as we're building new buildings and things like that, how do we then take what we're learning now into the design and architecture for these buildings of the future? So in case we have these types of conditions again, will we have edifices that will allow us to use them in a way that's going to be safe, for everyone? We already have had training and so forth of active shooter training, for example. I mean, that was not that long ago, right? When we were looking at how were we going to mitigate the way we're meeting with our students on campus during something like that. So the same seriousness goes into looking at the fall and going forward. And we know a lot of universities, many universities are making those decisions or still in the process of doing so in terms of deciding if they're going to allow students back on campus or not. For example, one of the workshops that RIT Diversity Theater presents using the film Brick by Brick is for the freshman orientation class called RIT 365. And we did a pilot with those classes this past fall, which was received well. So now we are rolling it out to the entire freshman class. I'm working with Student Affairs, a wonderful organization, headed by Sandy Johnson as the VP, in terms of being able to design experiences for our students, especially in that first year, that will get them integrated into the community of RIT, feeling recognized and being able to take advantage of all that RIT has to offer. So this one particular experience that Diversity Theater developed with them is using the film Brick by Brick. So what we're doing now and over the summer is piloting, trying to port that online so that we can have this type of a class online. But we are also limited with certain, parameters around the size and how long it's going to be. So for example, 100 students on a 50-minute course that's going to be done online, and still trying to engage them with critical thinking and being able to do small group discussions and things like that, and being able to manage that. Of course, we have a person who's the administrator for this call right now, who's behind the scenes trying to make sure we're all, heard and seen, and people can get access. So, it's not just the content, right? And it's not just porting the material to an online space, but it's also the infrastructure to support those types of interactions using, yes, technology and all the means that we have for that. But what does that really look like? And it is taking a little bit of time. I mean, we got through the spring semester because we had to, right? In terms of whatever we could do to get those courses going and have an enriching and rewarding experience for all involved. And we have the same commitment going into the fall. And so I trust, our leadership teams in terms of what they're looking at and the decisions, that they are having to make. And we are sitting ready and waiting to support those by what we're doing right now to recreate, these types of experiences online. But it has to do with space and the efficient use of space and other means and ways of accessing, right, the resources that we have. And I'm just so thankful that RIT has already been in the forefront, of these things. We've been doing online, classes and things like that, at least ever since I came to RIT in 2002 or so, or something like that. With those types of things, and being able to recognize that we have students who come from non-traditional pathways, to RIT. I mean, we welcome students from all different geographic and demographic areas to RIT. We have the Rochester Scholars Program, and we have other ways in which we've been supporting students, and we have additional programs within the Division of Diversity and Inclusion, like C-STEP and HEOP and I'm First, and several programs, so that students can still feel connected in small groups, and also being integrated for their success in the larger community of RIT. So we've been in the forefront, I believe, of making sure that we are speaking to the students as individuals and collectively. And I have no reason to doubt that those will be the same frameworks that we're going to be utilizing to support that going into the fall, regardless of having a campus that's open physically in the way it's been before. There's no going back to normal. I mean, yes, we want to be better than we were before, like Jessica was saying, in terms of when you have recovery, but we also know that there is no regular normal of going back to the way things were before. I think we are forever changed, and I would say changed for the better. But it does mean that we have to sometimes let go of the framework that we had before and be able to adopt new ideas, new approaches, even new voices, having our students having a voice in what that campus experience should look like. When we've done that in the past, we've been able to partner and really provide experiences for students that are customized, and also addressing some of the needs that we may not have seen if we had not included the students at the table.
Yeah, that's a great point, Tina. And I think what Jessica said earlier about there is no, the definition of returning to normal. What does that really mean? Yeah. So Jessica, I'd like to throw it to you and maybe share some other critical thoughts around, around this topic. And, maybe for everybody who's on the call here, what are some talking points or different key takeaways we could have from a discussion around our vulnerable populations?
I feel like those are two very different questions. So let me separate takeaways out in a second. We'll put a pin in that. The other critical thought I think that I had was considering and weighing the role of something like contact tracing in terms of privacy and democracy. So that if we are following people through their phones without their consent, and just having, for example, cell phone companies that are just doing it. At the time of Katrina, I knew from people who worked in cell phone development that this happened, but no one was allowed to know. It was like classified, secret, like security clearance information. They weren't supposed to talk about it. In the time since 2005 and the present, right, we've had a shifting where now the big tech companies are like, yeah, we're totally contact tracing you. We're making maps of it. We're putting it online. You can sign up here to make it easier for us. I think we might want to think about what civil liberties we're giving up when we volunteer and sign up for contract tracing, but also what it means that we're being sort of observed. Because if we take it back to bigger issues in terms of the protests that we're seeing over the last week, this is about policing and policing of communities, and contract contact tracing is a form of policing. And we might be policing for a good cause. The question is, are we putting any kind of laws or policy in place that says this expires as of August 1st, 2020, right? So you can contact trace for COVID through August 1st, but after that, it is not allowed anymore, right? So that if we're going to use the technology in this way, we should be mindful about what that long-term impact is in terms of other relations. And it's not just the contact tracing. I get on and have, done some lectures in my classes in science, technology, and values about things like smart houses and smartphones and your smart refrigerator, right? So if your smart refrigerator is taking a picture of the contents inside your fridge, and anyone who can hack your phone can get into see inside your fridge, right? That data can be used in other ways, in the same way that your various devices of Siri, Alexa, Cortana, they're always listening, and that is always listening and recorded and can be used in a court of law now. So I think when we think about how we go about planning the recovery, managing the outbreaks, being responsible, on the one hand, hiring 30,000 contract tracers makes sense because we have over 300,000 cases here in New York State. But at the same time, we want to think about how do we, or should we, ought we to put some kind of bookend, right? I'm trying to make my bookend far out, but maybe it should be kind of short, right? A bookend to say at some point we're going to stop doing this because that's starting to erode away democracy. It's starting to erode away personal liberties. It's starting to erode away privacy for everybody, right, in all communities. And I think that that's something that's been absent. So in terms of critical thought, I'm glad I have tenure as I say this, right? We need to be critical, at least discuss it. Even if we go back and do exactly what we're doing, that's fine. But I think we should at least give it a moment of conversation and reflection before we all just say, yes, follow me everywhere I go. Or yes, it's okay to share this with private businesses. So, for better or worse, as many complicated feelings as we have about our government, we have the power of elections to remove people from government if we don't like the way they're doing something, but we don't actually have a lot of power to stop large privatized corporations who have our data. So once we put certain things into play, we can't actually take it back, or it would take, right, large government action to do it. And when we're fighting a pandemic, we don't have the bandwidth to pay attention to maybe some of these other issues, but they're there. And I think they continue to be important because they're perennial and they feed into this in a variety of ways, right? So I think we have to be really mindful. And I'm sorry, the sun has just come out all day. This is a great spot for Zoom meetings, but now it's like blazing sun. I think we have to be really mindful about what we're agreeing to or how we go about and doing this if we want to, say, come out of pandemics that reduce vulnerabilities or recreate a society post-pandemic that is more just or more fair or more equitable. We have to think about some of the ways that our technologies we're using to fight COVID might also function to reduce that opportunity on the back end. I'm going to slide back. There you go.
Thanks, Jessica. And Suzanne, I'll pose the same question to you. I think that's something that not a lot of people are thinking about is those long-term implications and contact tracing, things like that. But if there's some other final thoughts or critical thoughts you'd like to share, especially with our audience here.
Sure. So Jessica and I had a discussion about this a bit earlier, which is the contact tracing, doing testing in low-income communities or highly vulnerable communities. There are all kinds of issues surrounding that. The challenge gets in when there are issues, for example, one of the very controversial issues in disaster management is having these data sets of people who are highly vulnerable and being able to get to them. So those are really, it is very controversial because there is a huge amount of how much of my privacy do I want to give away? The challenge is when there, for example, is a raging wildfire and you want to know how many people are sitting on ventilators. You want to be able to go to find them. You need to be able to who is signed up. So this is actually getting into some of those issues, and it's very complex. There's a lot that we're going to have to work out. So I would say one of the things is that prioritizing an investment into these key problems before we start having these multiple disaster events. That's going to be very, very important. And then again, it's also looking at the targets for these culturally competent solutions. So it might be perfect for me as somebody who lives in California. It might be completely inappropriate for somebody living in Missouri. It might be completely inappropriate if I'm undocumented and I am working the grape fields. There's really big differences. And then how we're going to address this is huge. And I think this is where, this is a very big passion piece for me. This is where I work. This is where I'm really working with governments on that cultural competency piece. But I think it's even more highlighted now. So, and the bottom line of that is just really coming together. We call it the whole community approach. We really need to look at who our communities are, and we need to figure out how to serve everyone in that community. Just not the people with the money, just not the people who are the most highly vulnerable, but everybody. And figuring out, and the only way we can get there is by building these collaborations between these different organizations, the private sector, civil society, all the communities that are at risk, identifying these problems, guiding these problems, and then really focusing on how to make investments now and those people who are particularly at risk. And those are the diverse populations. So that's sort of my critical thoughts going forward.
Thanks, Suzanne. Yeah, it's the compounding effect of multiple disasters certainly is something I think we'd all, be worried about. But I want to, we've hit the hour mark, but I think we do have a couple more minutes here. And Tina, I want to give you a chance to weigh in too on your thoughts. Certainly, any last thoughts you'd have on as we navigate this situation, certainly from somebody who works on campus and has a student aspect.
Well, I'll try to respect the time too, so I'll be as brief as I can. But final thoughts for me, in the wake of all that has been going on, over the past week and then some, I would say leave with the words hope. To leave with the words hope. Of course, we've identified and outlined all of the challenges facing us and those to come. But when we lose hope in the current state or in the present state, then we can't really be prepared to address and deal with the work that's in the future and that's ahead. And I have just found ways to be hopeful, sometimes in the small things of talking with my neighbors and being able to come together and find ways to support one another and the little people in our lives to support them too. Because that's important. And it's okay to have them with you at work. It's okay to see them on the screen because they do exist. And regardless if we hear them or not, they exist. So hello and welcome to see you here. But that's what's important at the end of the day, that we know where our children are, where our family members are, and that they're okay. I have a son in Germany, a daughter in Japan, and another son in Florida. And out of everything that was going on, it wasn't until I at least heard their voices to know that they were okay, that I could then have the wherewithal to do the work that I'm doing. And yes, I have sons who are men of color. And do I pray for them every day and their safety? And I always have. Have we given them those talks of what to do when you're pulled over by the police? We started that even before they got their driver's permit. And we do the same talk also with our daughter as well. But those are the realities, that we're living in. It doesn't mean that has to always be this way. And I think that's the hope part, that when we see people who either look like us or don't look like us, who are joining together to bring their best efforts in their work and all their expertise that they have to address these issues and these inequalities, that's what gives me hope. And I'm very even just pleased to know that we have people like Suzanne and Jessica who are doing the work that they're doing in their respective areas, because they are keeping their finger on the pulse and helping and doing things that some of us don't even know are issues until maybe it's upon us. So thank you, for your service.
Oh. And thank you for inspiring. The whole, diversity theater piece is just so exciting. And I think there's a huge role, Tina, that you could play and the theater could play in moving words out and bringing that theater to the streets. And I think that is it's worked so beautifully in so many other countries. And I think it could, just expanding out here.
Thank you for that.
Brick by brick. It's good stuff.
I'm glad you got a chance to see that, and I'd love for all the alum.
When I
to
come
be
back,
able to
I will.
I did put a link to Brick by Brick in the chat. So for those who are still on the call, please feel free to check that out. And I do want to put a couple plugs in, both for Brick by Brick. But Jessica, I know you've written a book. And is it available? Is it something we can go out and purchase on Amazon, or is it?
Yeah, there may only be about 4 copies left on Amazon because it's kind of run its course. People forgot about Katrina, but it is Surviving Katrina: The Experiences of Low-Income African American Women. It is by Lynn Reiner, First Forum Press. And I think one of the things that is helpful is you can read that and really see the ways that, for example, the militarization of the humanitarian response to Katrina has many parallels to what we're seeing today. So, for example, when I interviewed 51 different women and learned about their family experience and the lived experience of Katrina, one of them reported that, they were waiting for evacuation buses and the police were holding them at gunpoint, right? They didn't have any weapons, they didn't have any food, they didn't have any clothes. They're waiting there for a bus and they're being held at gunpoint by the police out in the suburb that's immediately adjacent to New Orleans on the West Bank. And, I think when we are having broader conversations and trying to understand the current tides of how we get to this week with the process that we've seen, we can look back to Katrina and say, okay, it's been now, that was 2005, so 15 years. We know this, we've seen this, it's been documented, and we still didn't act on it. And so we can continue to not act on it, or we can say this is really the time to make that change. So that is available, and it really focuses on the voice. So it's a qualitative book, it's not a stats book. So if you want to understand how these women articulated their experience themselves, and I did not go and rewrite for them at all their voices, this is a chance, because actually I think there's maybe like a handful of studies on the experience for public housing residents in that time. There's very few projects that actually looked at the experiences of people at that degree and level of poverty. So it's unique in that, right? It also did win a Little Book Award at one point too, which I'm a little proud of. So.
Thanks, Jessica. And Suzanne, where can we find information on the Frew Group and some of the work that you're doing?
Sure. Thefrewgroup.com. It's my website, and I would definitely invite people to go on there and take a look, and you will see, I think if you go right on the front, you'll see some pictures of Katrina. And Tina, I actually worked for IBM in response to Katrina. And I was there working with the religious communities and working with some very difficult issues with sheltering in. Just some very big challenges for people who wanted to stay very far away from the government. So I've seen that and then I worked with IBM out in Southeast Asia for the Indian Ocean tsunami. We were out there in response to that. So, and working with some incredible situations out there. But I would definitely thank you for asking that, John. Yes, going on www.thefrewgroup.com.
Thank you so much, Suzanne. And thank you to all three of you. I will say to our audience, if you have additional questions that we can ask of any of our presenters today, you can email those to ritalum@rit.edu. All audience members will receive an email from us in about a week with a link to today's webinar recording. And you can see a full listing of upcoming virtual events like today's webinar at rit.edu/alumni/Tigers Staying Home for a listing of all those events. And we have several each week, and we'd like to include as many of you as possible in these events. So with that, that's all for our webinar today. Again, thank you, everyone. Please stay safe, stay healthy, and to exit this webinar, all you have to do is hit the X in the upper corner, and you are all set. So thank you again, everyone, and enjoy the rest of your week.
Thank you.
Thank you.
Thank you for hosting, John.
Bye.
Bye-bye, everybody. Stay safe.